politics, cultural exchange, social life and ecological issues. These are only few areas where international organizations implement their projects. They cooperate with public and private partners, and preserving peace for future generation is their principal goal. How do they arrange their work? What role is given to Kazakhstani initiatives? You'll find more on this in Kazakhstan International Vectors. Medicine is one of the most rapidly growing and challenging spheres of current human development. When people want to change themselves drastically, they should first of all review their diet and carry out some physical activity. The year 1087, the passion to spectacular celebrations and tasty food killed the king. William the Conqueror, the ruler of England, became so obese that could hardly ride a horse. However, his title obliged him not only to go around his lands on a regular basis, but also appear on battlefields. One day after falling from his horse, William was deadly injured. Historians have no doubt that the reason for that was his excessive weight. Over the centuries, the fashion for feasts has changed by the fashion for thinness. In 1890, chemist Wilbur Atwater for the first time splits food into separate nutritive components, proteins, fats and carbohydrates, and measures the caloric value of all of these groups. His research became the basis for many weight loss programs and diets. Nowadays, while some people suffer from obesity, others die from malnutrition. Among the reasons are natural and climatic changes, economic instability and even political reforms. For instance, in the middle of 90s, North Korea experienced a mass famine which took hundreds of thousands of lives. And according to the data for 2012, in sub-Saharan Africa, each fourth person suffers from malnutrition. Long time ago, world experts came to the conclusion that hunger and obesity were the two main problems of humankind, and whereas more than 800 million people throughout the world suffer from malnutrition, the number of those who have obesity problems is about 2 billion. Therefore, excessive weight is considered as one of the principal risk factors of non-infectious diseases development, such as diabetes and cancer. According to the World Health Organization, the problem of obesity, which earlier has been typical only for rich states, is now more and more spreading in low and middle-income countries. Indeed, prices for healthy organic food products are growing, and the sum spent on treating obesity-related diseases and sick leave payments around the globe reaches 2 trillion euros. So, how long will the world community suffer from the population's appetites, and how can we avoid astronomical costs on health services? Each third inhabitant of our planet is an office worker who leads a sedentary lifestyle. Along with vision and cerebral disorders, scientists added overweight to the list of occupational diseases of such people. In some countries, employers are engaged in solving the problem of office obesity. For example, some large companies in the US and UK suggest to their employees low-cost membership cards in fitness clubs, and other companies regularly turn off elevators in office buildings. In some places, workers even get cash bonuses for losing excessive weight. A healthy lifestyle has become a trend in many countries around the world, and Kazakhstan is not an exception. This is proved by the statistics. The number of people in the country living an active life is increasing from year to year. Okay, now take this, hold the second arm. Good. Now we'll work on the upper chest muscles. Are you ready? Nowadays, in the age of hypodynamia or sedentary lifestyle, people almost do not move. Not all of us have the information about how to eat and do sports in the right way. At the same time, people understand that their health is getting worse from year to year and that they have to do something to maintain it. International specialists calculated that losing excessive weight can increase the average human life expectancy by 5 years. Professional trainer Valihan Ten also believes that it is a true fact. He advises to his clients to change not only their lifestyle but also their eating habits. A simple truth that we are what we eat is widely known to people. Nevertheless, for some reason, only less than 1/3 of the planet population consumes a healthy food, the trainer says. Let's take fast food as an example. Everybody understands that it is a core business, but it is not always good for human health. But unfortunately, our taste receptors play their role and people indulge in eating. Child obesity is another serious problem of modern public health services. According to international experts, presently 42 million children under the age of 5 years suffer from overweight. This results in a great number of chronic diseases in their future adult life. Because of that, trainers encourage younger generations to develop healthy habits from the early childhood. Camila, now we shall pass to crawl swimming. You should cross the pool 8 times. Breathe out after each 3 strokes. Control your breath and move actively with your legs, all right? Go on, honey. A healthy menu for population is being developed not only by nutritionists, but also by the representatives of international organizations. Thus, the UN has already proposed 60 nutrition recommendations. Many countries use them as the basis in the development of their own food security programs. The World Health Organization renders proper technical assistance in carrying out of policies and promotion of various new technologies. It plays the dominant role in these aspects. The World Health Organization, or WHO, is the directing and coordinating authority for public health within the United Nations system. It was founded in 1948 with headquarters in Geneva, Switzerland. To date, WHO has 194 member states. According to the World Health Organization, inadequate food is the main reason of almost 1/2 of children mortality cases around the world. Upon that, 51 million children under the age of 5 years suffer from malnutrition. They carry out researches and attract to their work other international associations in order to help countries in overcoming the food deficiency.
Our role is, first of all, to provide global norms and standards, what is necessary for a healthy life in terms of nutrition, starting from early life, from breastfeeding, through feeding of small children, composition of diet.
WHO also leads in the battle against obesity, and even the development of non-infectious diseases is directly linked to overweight. According to WHO, each year 16 million people die from diabetes, cancer, stroke, heart and lung diseases before they reach 70 years of age. At the same time, doctors are confident that early prevention can help to avoid 42% of disease cases. Apart from smoking restrictions, WHO specialists propose to reduce promotion of unhealthy diets. To implement these plans, the organization suggests governments of countries to invest from $1 to $3 annually in each citizen.
In order to address the problem, the epidemic of obesity and overweight, the World Health Organization is working with the scientists, but also with governments, to develop specific strategies and action plans, how the government can, in their own country, develop a plan. And for example, Switzerland has, together with the WHO, developed many programs in big cities where people have special places, open places, where they can engage in physical activity.
Nowadays, the World Health Organization unites governments, representatives of medical groups and private partners in the battle for health of each human being. However, not all the social threats lie in serious non-infectious illnesses. Epidemics and pandemics of various diseases have been threatening human health since a long time ago, and from time to time medics register new outbreaks. The 19th century plague raging in China takes thousands of human lives. The amount of its victims in India reaches several millions. This disease not only kills people, but also leads to immense economic losses. Special epidemic prevention councils were established so as to prevent trade partners from cancelling contracts. The majority of them were functioning in seaports. They supervised arrival of goods and decontaminated ships. At the same time, the healthcare system underwent its first major reforms. The first attempts to establish the global healthcare system were made as early as in 1887 by Otto von Bismarck. At the same time, the health insurance system was founded, and this experience was recognized all over the world. And the expansion of Germany's experience based on compulsory medical insurance began. In the early 20th century, medical researchers demonstrated that the majority of contamination cases occurred due to banal lack of knowledge about the spread of viruses. Then public organizations assumed the task to inform about the entire world population. For that purpose, the World Health Organization, as the agency of the League of Nations, was created. It was publishing the information about infectious diseases along with shocking mortality statistics. This informing system has covered about 90% of the world population. In 2014, the world community was shaken with the Ebola outbreak in Western Africa. Contamination cases still take place. Meanwhile, the amount of victims of this devastating disease has reached almost 9,000 people. Understanding the threat of further spreading of this epidemic to other countries, international scientists continue searching for the vaccine against it. The research work of WHO specialists in this issue plays quite an important role.
For example, if you look at the tropical diseases and many diseases in Africa, they would never be on the agenda. The World Health Organization has a major program which is called Neglected and Tropical Diseases, where we are promoting research. But we are also promoting research in other areas.
A bright example of the organization's work in this area is studying cases and battling against yellow fever. The spread of this virus is typical for densely populated tropical regions of Africa and Latin America. Every year, 200,000 people in the world get infected by the yellow fever. From that number, 30,000 cases are fatal. These figures have made international organizations begin a major campaign against the spread of yellow fever. Vaccinations in 10 poorest African countries were carried out. Volunteers from Europe and the US took part in this event. All that proves once again the efficiency of the program, focused on battling against tropical diseases. The World Health Organization is like the World Ministry of Health. It can really influence activity results in various countries. It can also study some positive experience and then extrapolate it. The WHO office in Kazakhstan holds meetings and discussions with the Ministry of Public Health and Social Development every 2 years. Jointly with their partners, they determine new areas of activity. The vaccination program is one of them.
For example, in the area of infectious diseases, we are working closely now with the Committee for Consumer Rights on strengthening the Kazakhstan immunization calendar. It is very good, but we are looking at how the country can even better ensure the coverage of people, of children with vaccines that will prevent them from getting sick.
This year, the World Health Organization has represented its recommendations to its member countries. Thus, for example, the European region has already adopted the strategy on public health development until 2020. It calls for the comprehensive approach to the improvement of quality of medical services.
All sectors have to work together, thinking how their policies and actions are influencing health, as I said, for example, transport, education, industry, Ministry of Finance. If they increase the taxes on tobacco and alcohol, it will reduce the consumption by young people.
They do not eat fat food and finish their meal with a cup of green tea. Their average life expectancy is 82.5 years. At the same time, the cases of serious and incurable diseases there are rarer than in other countries. World scientists have recognized Japanese people as the healthiest nation. Residents of the land of the rising sun walk a lot and practice martial arts. Meanwhile, the substance called alginate contained in algae, one of their basic daily meals, prevents prevents the human body from fat absorption. This is the reason why obesity affects only 3.5% of Japanese people.